Okay guys, I'm going to show you one last trigger point release, Travell trigger point release on pec minor. And I'm showing you this one because there is a palpation video for it. So go ahead and take a look at that. It's just a sensitive area, so I'm going to give you guys some tips and tricks for dealing with it. I have already massaged Paige in this area really well to warm her up. So obviously the concern with massaging this area, well, there's a number of concerns. There is the breast tissue is in this area, so depending on how big someone's breasts are, this can be problematic. So you can put them into side lying. We're going to do side lying massage on Wednesday, so you can practice doing that at that time, or you can practice it now. You need to warm up the area really well. The second biggest problem is that it's a really ticklish area, and so people may not allow you to go into their axilla. So you might need to warm them up really well. You may need to focus on working all of the muscles surrounding all the myotactic unit and the synergists and everything before you're able to get into the axilla. And you may need to just help them relax, like I said, do a couple things to help them get into a relaxed state so that it's less ticklish when they get there. So I like to sometimes put the arm at different angles too to massage the pec major. Just taking the scapula and the humerus up and away and helping her to relax a little bit. Paige is really good. She's doing nice deep breaths, which I'm grateful for. Remember to tell your clients to do that. So what I like to do with pec minor is I like to do a few massage strokes with my fingers on the pec major in the anterior portion, and then my thumbs kind of going into the axilla and warming things up a little bit. Remember, we need to get up all the way up to the coracoid process. So you definitely need to have the arm abducted away from the body. The closer it is towards the body, the more cumbersome this palpation will be. So make sure you abduct away from the body, and they can just rest their hand gently on their abdomen. So I'm going to use my thumbs, and I'm going to work my way up gently and slowly towards the coracoid process. So it's really up on an oblique angle here, up and in. And now I feel like I'm on a bony structure here. What I'm going to do is go oblique like this. And judging by Paige's face, we've found it. And now I'm looking for the projections that go onto the ribs, so ribs 2 through 5. And just keep taking some nice deep breaths here. So I'm kind of moving my thumb gently back and forth, looking for those rib-like projections. And I have found a point of tension here. This is a really incredibly tight muscle for a lot of people. If you're on a pulse at all, make sure you get off of it. That's the brachial artery, and you don't want to ever be pressing on an artery. So make sure that what you feel is more muscular, and to double check, you resist the action. So first of all, I could get Paige to take a deep breath, and that's definitely it. I feel it. But if I wasn't sure, I could also get her to resist bringing the scapula forward. So resist me here and relax. She doesn't want to do it. She doesn't want to do it because we already know we found it. So, but if you were unsure, then you could do that. So get them to bring the shoulder forward into medial rotation, and that will pop it up into your hands. Okay, Paige, so is it tender?
Yes.
On a pain scale of 0 to 10, 0 being no pain at all, and 10 like putting your hand on a hot burner, where would you put it on the pain scale?
6.
It's a 6. Okay, and does it radiate?
No, it's staying pretty local, actually.
Okay.
Nah, little bit wrapping around the ribs.
Okay, so that makes a lot of sense. So make sure when people tell you about referral pain that you make sure to put that into your chart notes. Remember that you mark in your chart notes an X where the trigger point is, and you put stippling, red stippling, around the area where the referral pain is felt. So in this case, I would put the X right around the, I'm going to say 3rd rib, and or maybe 4th rib actually, and then I would put some red stippling around the inside of that there, wrapping around to the posterior aspect of that rib. So the deeper the breath that she takes, the more that pushes up into your hand. But Paige is doing great. She's able to relax into this. This is not her first rodeo. She's had these trigger points done before. And remember, Paige is a massage therapist, so this is pretty typical to find in a lot of massage therapists since we're all very rounded through the shoulders because of our work. All right, I can feel this starting to relax a little bit. Where would you put this on the pain scale now?
Probably around a 2.
Okay. I can feel that there's a softening happening with my thumb. I have my thumb here and I have it reinforced by my other hand. And remember, when we're doing that, the bottom hand is the hand that's palpating and the top hand is the one that is creating the pressure. So this is really no problem for me, especially because I get to sit on my TV stand. My body mechanics feel pretty good. This is not taking much effort at all for me. So make sure that you can stay relaxed through this, and then you'll be able to palpate more as well. And where would you put that now, Paige?
About a 1.
Yeah, so I can even feel this, and I probably could have guessed even the numbers that she was going to tell me just by what's happening under my thumbs here. But make sure you get that good feedback from them. And when you both feel complete with this, just communicate with them, okay, I'm going to come out of here. We're just going to do a little bit of massage. So come out really nice and slowly, especially in these sensitive, ticklish areas, because it's going to feel tender. Remember that you've placed an ischemic compression in the area, and what happens when you place an ischemic compression and remove it is that all of this blood rushes to the area. There's been no blood rushing there. And now all of this blood is rushing there, and pec major or pec minor is right beside the brachial artery. So there's a lot of blood that's gonna rush to this area. She may feel warm, tingly in the area. There might be other sensations. So you really need to make sure to flush this area out really well. I might even sort of passively move her arm a little bit, get in there with some more flushing. The bonus of it is that it's also close to the major veins that drain the arm and a lot of the lymph nodes and stuff, so it will actually drain and shouldn't be too sore, hopefully, tomorrow. But I could recommend that she do some movements, so I might recommend for Paige to later on do some active range of motion with the shoulder and especially with the clavicle. Take some nice deep breaths. Make sure you instruct them to keep things moving. If they go for a walk, they can do some movement therapy and swing their arms while they walk. Just some suggestions like that to keep blood flow moving through this area and make sure all of those metabolites get moved out of the area. Okay.